Good afternoon, Madam Chair and members. I am pleased to present AB 2531 today. In December of last year, the Trump administration finalized a rule to prohibit the Veterans Health Administration, known as the VA, from providing abortion care. The potential effects of this decision are profound. Veterans in California who have worn the uniform and put their lives on the line are now being denied basic reproductive health care from the VA because of the Trump administration's discriminatory policies toward women. Throughout my tenure in the legislature, I have always maintained a steadfast commitment to our veterans. Whether it's through my time as chair of the Military and Veterans Affairs Committees or through legislation I ran to place Proposition 1 on the 2024 ballot, it has always been a priority of mine to ensure that we take care of the people that have served our country. And taking care of our veterans is exactly what this bill does. AB 2531 puts our veterans first to where the federal government has failed them. It narrowly expands access to our existing uncompensated care grant program, so it will include veterans whose federal health care coverage does not include abortion services. This will ensure that our veterans who cannot receive abortion care or counseling through the VA health system are not left behind. The bill also requires that the California Department of Veteran Affairs include a link to abortion.ca.gov in their existing list of resources for veterans to ensure that our veterans know that they have access to their critical health care coverage. With me to testify in support of this bill today is Angela Pontes on behalf of the bill's sponsor, Planned Parenthood Affiliates of California.
Thank you, Chair and members. Angela Pontes on behalf of Planned Parenthood Affiliates of California, representing the 7 Planned Parenthood affiliates across the state. We are a proud sponsor of this bill, and we thank the author for addressing this issue. As stated, AB 2531 responds to recent federal action that severely restricted access to abortion care through the VA system. Under this new policy, the VA can only provide abortion in life-threatening circumstances, which we know is an intentionally ambiguous threshold that has dangerous and cruel consequences. Despite California's constitutional protections for reproductive freedom, our state's veterans and VA providers cannot obtain or provide abortion care. To address this inequity, AB 2531 would narrowly expand eligibility in the uncompensated care grant program to include veterans. Without this bill, veterans may only access care by paying out of pocket at a non-VA provider. Planned Parenthood Health Centers are proud to be amongst the state's uncompensated care providers that offer abortion and contraception. We ask for your aye vote.
Thank you. Are there others in the room who would like to offer a Me Too in support? Please come forward, state your name, affiliation, and position on the bill.
Good afternoon, Madam Chair. Roxanne Gould with the American Association, California Nurses Association, in support of the bill.
Good afternoon, Chair and members. Symphony Barbie on behalf of the ACLU California Action in support.
Charles Wright on behalf of the California Association of Veteran Service Agencies in support.
Craig Pulser on behalf of Equality California in support.
Good afternoon, Chair and members. Keshav Kumar with Lighthouse Public Affairs on behalf of Reproductive Freedom for All and our over 400,000 California members in strong support.
Good afternoon, Chair and members. Jessica Moran with Capital Advocacy on behalf of the California Hospital Association in support.
Kevin Guzman with the California Medical Association in support.
Second.
Moved by Patel, seconded by Rogers. Seconded by Majority Leader Aguirre Curry. Are there any primary witnesses in opposition? Please go ahead. You'll have 2 minutes.
Thank you. Chair and members, my name is Leandra Wells with the California Family Council. I'm here today to oppose AB 2531, which uses taxpayer dollars to promote abortion to military women. This bill fails to provide the true support our military women deserve. I recently heard the story of Bethany Sorrows, a veteran who shared her horrifying abortion experience. She explained that there is an assumption that women in the military will choose abortion if they want to continue serving, rather than be seen as using pregnancy to avoid deployment. As she put it, quote, "A good soldier will have an abortion, continue the mission, and choose duty over motherhood," unquote. AB 2531 reinforces that same message that in order to serve your country, you must end your child's life. This assumption undermines women's capacity, dismisses their unique ability to bring life into the world, and overlooks the support system that enables them to succeed in both roles, such as adoption, pregnancy centers, safe surrender locations, and other material assistance. Solely promoting abortion on government websites without equally presenting alternatives is a breach of public trust and fails to provide balanced information. I believe when women are equipped with resources, they are empowered to choose life. Additionally, abortion is associated with a higher risk of mental health issues. According to a study by Priscilla K. Coleman, with a PhD, women are 34% more likely to develop anxiety disorders, 37% more likely to experience depression, 110% more likely to engage in alcohol misuse, and 115% more likely to exhibit suicidal behaviors. We must ask ourselves, is it truly what we want our veterans to endure? The U.S. Department of Veterans Affairs reports that veterans already experience higher rates of PTSD, depression, and suicide risks than the general population. Is the military prepared to take responsibility for both the moral implications and the psychological effects on the women who serve our country? For these reasons, we respectfully urge a no vote on AB 2531. Thank you.
Thank you. Are there any others in opposition? Please come forward with your name, affiliation, and position on the bill.
David Bolog, SFV Alliance, in opposition.
Greg Burt, Vice President of the California Family Council, in opposition. Thank you.
Thank you. Seeing no other opposition, I will bring it back to the committee for any comments or questions. Assemblymember Patel.
Thank you, Assemblymember Irwin, for bringing this bill forward and protecting our constituents in ways that they didn't realize they may have needed protection. Can you clarify a comment from the opposition? Are we talking about veterans or active duty individuals?
The bill as drafted applies to veterans.
Thank you. Assemblymember Stephanie.
Thank you, Chair. And I want to thank Assemblymember Irwin for bringing this bill forward. As a daughter of a Vietnam vet, I am very in tune with how much we don't do for our veterans, and I think this is extremely important. Also, I just want to address the opposition. I think the assumptions being made about our female veterans are quite frankly offensive, as if they can't make informed decisions for themselves. And if you're taking co-authors, I would like to be one.
As Majority Leader?
I'd like to just be a co-author.
Well, thank you. With that, I don't see any other committee comments. Thank you, Assemblymember Irwin, for bringing this forward. I think at this time right now, when we have so many of our military engaged in battle to protect and serve this country, I'm very thankful that you've brought this forward and always mindful of your commitment and passion to protect our veterans and those in service. Thank you. Would you like to close?
Just respectfully ask for your aye vote.
Thank you. We have a motion and a second. Please call the roll.
The motion is due pass to the Military and Veterans Affairs Committee. Bonta.
Aye.
Bonta, aye. Chen. Addis. Aguiar-Curry. Aguiar-Curry, aye. Aarons. Caloza. Caloza, aye. Carrillo. Carrillo, aye. Gonzalez. Gonzalez, aye. Johnson. Johnson, no. Patel. Patel, aye. Patterson. Rogers. Aye. Rogers, aye. Sanchez. Sanchez, no. Schiavo. Sharp Collins. Stephanie. Stephanie, aye.
That bill's on call. Thank you, Assemblymember